I'll just talk about briefly e-cigarettes, an overview of the design, the constituents, and the health effects. And can you guys hear me clearly?
Yes, you sound great.
Okay, wonderful. Now, I have several slides, so I might just run through a lot of these slides really quickly. Since the slides will be available, you could read them later on. So in terms of disclosures, all of my research is funded by the National Institutes of Health in the US, the NIH, and also the US FDA, and the California Tobacco-Related Disease Research Program, what we call the TRDRP. The views are my own, and I do not speak for any of these funding agencies, so this is important that I say that. And I have no conflicts of interest to disclose. I'm not funded by any e-cigarette company or not funded by the tobacco industry. So as a quick overview, I'll be speaking about the e-cigarette designs. I'll be speaking about nicotine delivery from electronic cigarettes, and just briefly about toxicant exposure. So what toxicants are people exposed to when they use e-cigarettes? And just very briefly about the health effects. So I'll be speaking about cardiovascular effects, respiratory effects, and cancer. Broadly, just some of the conclusions from the National Academy of Sciences, Engineering, and Medicine, what the major conclusions were regarding these health effects, because it's just 20 minutes and it's difficult to really go into health effects in just this time. Now, it's really important that I say that e-cigarettes do not exist in a vacuum. So whenever people speak about electronic cigarettes, it's really important that we know that we're not just speaking about this one product that's by itself in a vacuum. There are multiple tobacco products, and whenever we speak about electronic cigarettes, we have to keep in mind that on the market there are multiple tobacco products. There are combustible tobacco products, which we know of. There are hookahs or water pipes. There are all sorts of different tobacco products. But the most dangerous of it all is combustible tobacco products, and there is no question about that. In the US alone, combustible tobacco smoking kills almost 500,000 people every year. Many different kinds of cancers. You have different chronic diseases like pulmonary disease, respiratory disease, different cardiovascular outcomes. In the US alone, 34.2 million smokers, that's in 2018. That represents about 13.7% of the US population. 36.8% of people who are low education smoke, so that's a high prevalence among those who are low SES. 35.5% among people with psychological distress. So we think that helping smokers quit is an essential role of public health. And it is, some people have suggested that electronic cigarettes may be able to help with smoking cessation, so we should consider that. Now, when we speak about the population risk versus benefits of electronic cigarettes, I always make this statement in whatever talk that I give, that the public health effects of e-cigarette use, it is really strongly influenced by the relative safety of e-cigarettes versus combustible cigarettes. And there are important determinants of the population risk versus the benefits of electronic cigarettes. And my research will focus mainly on these two. The addictive potential of electronic cigarettes, so the potential to cause or sustain tobacco dependence. And for that, nicotine delivery, which we know nicotine is primarily the addictive substance in tobacco products, including electronic cigarettes. So nicotine delivery, and not just delivery, but the intake of nicotine, this is crucial towards the addictive potential of electronic cigarettes, even though some other things might play a role. For example, flavors might play a role in the addictive potential of e-cigarettes, but nicotine is key. And then toxicity, so that's the other important determinant of the population risk versus benefit of e-cigarettes. So how toxic are these substances, are these products? And we know that toxicity depends on systemic exposure to toxicants. If there are no toxicants, then it cannot be toxic. So what toxicants are present in electronic cigarettes, and what level of exposure do people have? And then the pattern of use is also important, because if something is not very toxic and you use it a lot, you might have some health effects. But if something is really toxic and you use it a little bit, you might still have some health effects. So the pattern of use is also really critical for the toxicity of these products. Now, millions of adults in the US, and I don't have data for Canada, I just have data for the US. So millions of US adults and youth use electronic cigarettes. In 2019 alone, greater than 5 million high school and middle school students use electronic cigarettes in the past 30 days, what we refer as current use. That represented a 39% increase from 2018. And 2018 saw a big jump from 2017. So we see this continuous increase in the prevalence of e-cigarette use among the youth. Among high school students, it's 27.5%. Middle school students, it's 10.5%. And in 2018, about 8.1 million U.S. adults use electronic cigarettes. That represented about 3.2% of the U.S. population. Now, what are electronic cigarettes? These are a variety of, the designs vary tremendously, but they are all battery-powered devices. They're all battery-powered devices. They all have a heating element, whether it's a coil or what we call an atomizer, and they all have an e-liquid, the e-cigarette liquid, or for sure the e-liquid. This e-liquid could comprise of different ratios of propylene glycol and vegetable glycerin. These are humectants. And then most of them, not all, contain nicotine. Some people choose to vape nicotine-free e-cigarettes, but that's a minority. But most of them contain nicotine. And then most of them also contain flavors, and there are thousands of flavors of e-cigarettes on the market. Now, you've heard that nicotine could be in the form of the freebase, and I'll just briefly talk about this later. The freebase nicotine, and then if you've heard about Juul, you know about this nicotine salt, which has really captivated a lot of people. So the nicotine could be in the form of the freebase versus the nicotine salts, and I'll speak again briefly about this. So just talk about the basic design of e-cigarettes. You have the batteries. Some of the batteries are called the mini, which is used in cig-a-likes, which I'll show in a while. Then there are the ego batteries. There are what we call the mods. The mods are any of the e-cigarettes where you could change the voltage, or you could change the power setting, or you could change the temperature setting. These are called mods. So you have the tube mods. You also have the box mods. There are different atomizers. So this is what the cartridge atomizer looks like, what is found in the cig-a-likes. You have the tank atomizers. You could have the one at the top. Also, you have the one in the bottom here where you have the coils. There are also, this used to be a lot more popular about 4 or 5 years ago, the rebuildable atomizers, where people would make their own coils and then drip the e-liquid on top of it. I've not seen much of this lately. And then we have the Juul atomizer, or these new pod devices, which are becoming really popular. These represent about 75% of the e-cigarette market in the U.S. The different types of e-cigarettes, you have the cig-a-likes, which are designed to look like a cigarette, a combustible cigarette. You have the pen-style tanks, and these are, they come in like a single power setting, so you cannot change the power setting or the voltage of these type of devices. They are called the pen-style fixed power tanks. Then there are also the advanced personal vaporizers, or what they call the mods. These are variable power, variable voltage, variable temperature devices, meaning you could change the voltage setting, you could change the power setting, you could change the temperature setting on some devices. They come in different shapes. Some look like pipes, although I've never really seen this in real life, but most of them look like what is on the right, which is the box mod. Then you have these new devices which look like USB sticks, the pod devices. Juul was really the pioneer of this type of e-cigarettes, and these are very popular. This probably accounts for most of the rapid rise in e-cigarette use among the youth in the U.S. And you see this new ecosystem developing around this type of devices where people have built these bigger batteries and they use the same pod, Juul pods, in this type of batteries. So you see this ecosystem developing around the pod devices. There are Juul copycats. There are different types of devices that now look like Juul. Some of them are produced by the tobacco industry. And then there are different shaped devices like the Sorin Drop, the Sorin Air, the Sorin Vergon. All of these are really interesting looking e-cigarettes. Now, the major health concerns of e-cigarette use, we have addiction for sure because of the presence of nicotine, cardiovascular disease, respiratory disease, cancer, infectious disease, reproductive toxicity, developmental effects, acute nicotine toxicity. Now, I say that these are concerns. That doesn't mean that electronic cigarettes will cause or is causing cancer, but there are definitely concerns because of the potential presence of carcinogens like formaldehyde, acetaldehyde in the aerosol of these devices, which I'll talk about in a while. Now, why do we care about the addictiveness of e-cigarettes? We care about the addictiveness of e-cigarettes because of concerns about youth use and increased risk of smoking initiation and also progression. So not just initiating smoking, but progressing into an actual smoker. There's concern about whether the use of e-cigarettes might lead especially young people into initiating and progressing to becoming smokers. There's concern about the risk of relapse among former smokers, so persons who quit smoking might pick up electronic cigarettes and potentially start smoking again. That would not be good for public health. And then there are concerns about e-cigarettes facilitating dual use instead of smoking cessation. And a lot of persons who smoke, who use electronic cigarettes, they are dual users, so they might keep smoking while they're using electronic cigarettes. So there is a concern that e-cigarette might facilitate continued use of cigarettes even while people use electronic cigarettes. Now, the addictiveness of e-cigarettes is really related to nicotine delivery. Although flavors might play a role, the main addictive component is nicotine. So the more addictive, and this is a general rule, the more addictive nicotine or tobacco products, they produce high blood nicotine levels in a relatively short time, like this graph here showing cigarettes. You start smoking a cigarette and you have this rapid increase in your blood nicotine level, which is called a Cmax, a maximum blood nicotine level, over a short period of time. Whereas if you look, for example, at a nicotine gum, it takes this gradual, maybe over 30 minutes to get to a maximum level. And you could see why cigarettes are so much more addictive than a lot of other tobacco products. You also have a more rapid reduction in the blood nicotine level after the use of cigarettes. Now, nicotine delivery from electronic cigarettes, this is a study we did several years ago. The nicotine delivery from e-cigarette, it varies across devices. So you have devices that look like this, very low nicotine delivery. This is the blood nicotine levels. You have those that are slightly higher, but you have this plateau. And then there are those devices where the blood nicotine level look exactly like what you'd see from a use of a combustible cigarette. This pattern, this profile of the one in the red is exactly like what you'd see from smoking a cigarette. So you have quite a variability in nicotine intake from these devices. We just completed this study, and this study was just published late last year, maybe in November, December in 2019, where we compared nicotine delivery from e-cigarettes compared to combustible cigarettes in persons who use both of these devices. So these are dual users. And we had them on the research ward for 1 week, not for 1 week, but for 3 days. And then they use only electronic cigarettes, and then they come in the following week, they use only combustible cigarettes in counterbalance order. And this is comparing the blood nicotine levels from what you call a standardized session of 10 to 15 puffs, where they use the electronic cigarettes, and then the next week they use the combustible cigarettes. And you could see the one in the blue is the nicotine plasma nicotine level for electronic cigarettes, much lower than what you'd see from use of the combustible cigarettes, and much lower Cmax for the e-cigarettes. And this was regardless of the type of e-cigarettes used. So if you look at the top left, these were the cig-a-likes. The top right, these are the fixed power tongue devices. And then the bottom is the variable power tongue devices, or the mods. Although the mods deliver much higher levels of nicotine compared to cig-a-likes and fixed power tongue, you could see for all of these, the blood nicotine level when they smoke combustible cigarette was higher compared to when they use electronic cigarettes. And then we also reported another study. This one was published also late last year, where we looked at 24-hour subjective and pharmacological effects of ad libitum access to the e-cigarette use, to the e-cigarettes and combustible cigarettes. So this was the first study where we followed on a research ward participants for a full day, where they used the products for a full day. And you could see that over a full day, the blood nicotine level for combustible cigarette use was, again, significantly higher than what you see for electronic cigarette use. But for if we look at the different types of e-cigarettes, you could see that the one at the top is the variable tank, so the mods. These users were able to have higher blood nicotine levels compared to the average cigarette smoking, in contrast to the cig-a-likes and tanks. Now, just a quick note about nicotine salts, because I'm sure people will be interested in what nicotine salts are and what's the difference. Nicotine salts, so electronic cigarettes, the e-liquid could either come, as I've said before, in the free-base nicotine. And this free-base nicotine is a more volatile form of nicotine, meaning you use it and a significant amount of it is deposited in the upper airways. So if it's deposited in the upper airways, you have this greater sensory effect in the throat, what is called a throat heat. Whereas for the nicotine salts, it's a less volatile form of nicotine, and a much higher fraction of it is deposited in the lower airways. The lower fraction is deposited in the upper airways. So you'll have much less of the throat heat. You have, because a lot of it is deposited in the lower airways, you have much more rapid uptake of the nicotine. So that's the difference between the free-base nicotine and the nicotine salts. Interestingly, we had 3 Juul users in our study, and we did not see much of a nicotine intake in these individuals. I know a lot of people are concerned about Juul because of the high nicotine content of the e-liquid, but we did not see very high nicotine intake among all 3 of these users. If you look at pod user 1, very low nicotine intake. Pod user 2, the nicotine intake was just about, the plasma nicotine level was just about 7, but that's still really low compared to a typical cigarette smoking. And then for pod user 3, about 7 also. So we saw a really low nicotine delivery from use of these Juul products. So regarding I'll show some conclusions from the National Academy of Sciences, Engineering and Medicine comprehensive report on the public health impact of electronic cigarettes and what we found. And in full disclosure, I was a committee member who helped write this report. Regarding nicotine delivery, we saw conclusive evidence that exposure to nicotine from e-cigarettes is highly variable and depends on product characteristics and how the device is operated. We saw substantial evidence that nicotine intake from e-cigarette devices among experienced adult e-cigarette users can be comparable to that from combustible cigarettes. Now, just to talk a little bit about the constituents in tobacco smoke, and also e-cigarette aerosol that contribute to diseases. There's oxidizing chemicals like reactive oxygen species. The concentration of these are much lower in e-cigarette aerosol compared to cigarette smoke. There is no carbon monoxide because there is no combustion in e-cigarette aerosol. There is some volatile organic compounds like formaldehyde, acrolein, and so on, but much lower levels compared to what you see in cigarette smoke. There are particles. There's heavy metals that may be coming from the coils, but lower levels compared to what you see in cigarette smoke. And then there's nicotine and flavorants. So I may just skip through this in the interest of time. Now, speaking about the aldehyde formation, the aldehyde formation in e-cigarette aerosol is a power or temperature dependent. So the higher the power, the more aerosol, the more volatile organic compounds may be produced. This is a study we did a few years ago, looking at the effect of the voltage or power on acetaldehyde, acrolein, and formaldehyde, and you can see that the higher the voltage gets or the power gets, meaning the higher the temperature, the higher the levels of these volatile organic compounds. We also recently published a study where we compared volatile organic compound exposure from vaping, smoking, and abstention, and just briefly to go through this. And this is really showing the ratio for each chemical for smoking versus vaping. And you can see for all of these except the methylating agents, and that's because methylating agents, we've realized that these are not specific to cigarette smoke. But for all of these volatile organic compounds like acrolein, many of these are carcinogenic. Acrolein is not, but it's a potent respiratory toxicant. But for example, acrylamide, acrylonitrile, many of these toxicants, benzene, all of these were just significantly higher in smoking or in smoke when they smoked compared to when they vaped. We also looked at the levels of these toxicants in vaping compared to abstention. So during a period of vaping compared to when they did not vape at all. And we saw surprisingly significant levels of acrylamide when they vaped and benzene, and almost significantly higher levels of propylene oxide. So we saw 3 volatile organic compounds that were higher during vaping compared to when they did not vape. Really concerned about benzene because benzene is a known human carcinogen. So we're really concerned about this, and that may be coming. We do not know exactly what benzene is coming from, but it's potentially coming from benzoic acid. Acrylamide may be coming from the plastics that are used in e-cigarettes. So the National Academy of Sciences, Engineering and Medicine report, the conclusions regarding constituents and exposure. We found conclusive evidence that most e-cigarette products contain and emit numerous potentially toxic substances, but the number, quantity, and characteristics of these substances is highly variable, and it depends on product characteristics. For example, the power of the devices, the type of devices, and then how the devices are operated. So both the type of devices and how the human user uses these products. Regarding metals, we found substantial evidence that e-cigarette aerosol contain metals, and then limited evidence that the number of metals in e-cigarette aerosol could be greater. This is not talking about the concentration, but the types of metals. It could be greater than the number of metals in combustible tobacco cigarettes. And just to quickly talk about some of the health effects, so I'll start with cardiovascular diseases. And this is just showing the sort of the mechanisms, how if e-cigarettes cause cardiovascular diseases, how it could potentially cause these cardiovascular diseases. So there are metals and oxidant chemicals or particles that are present in the aerosol of e-cigarettes. This could lead to inflammation. This could lead to platelet activation or thrombosis or clot formation. This could potentially lead to endothelial dysfunction, atherosclerosis, which could lead to reduced myocardial blood oxygen and nutrient supply. That could lead to a myocardial ischemia or coronary heart disease. Nicotine also has effects on the sympathetic nervous system, so it activates the sympathetic nervous system, increased heart rate, increased blood pressure, and so on. Regarding some of the conclusions that this report found about the effect of e-cigarette use on the cardiovascular system, we found no available evidence whether or not e-cigarette use is associated with clinical cardiovascular outcomes and subclinical atherosclerosis. Now, I wouldn't say a lot, but some studies have come out that have shown the association between e-cigarette use and heart attack. These have been controversial. I'm not including these studies in there, but these studies have been controversial. But there is some evidence that e-cigarette use could potentially be associated with some of these cardiovascular diseases. We'll let the literature play out. We'll let studies play out to see whether these studies hold up. There is substantial evidence that heart rate increased after nicotine, which we expect because of the sympathetic nervous system activation of nicotine. And then there's moderate evidence that diastolic blood pressure increases after nicotine intake from e-cigarettes. We found insufficient evidence that e-cigarette use is associated with long-term changes in heart rate, blood pressure, and cardiac geometry and function. We also found substantial evidence that components, and this is important, components of e-cigarette aerosol can promote formation of reactive oxygen species, which could lead to oxidative stress, and that supports the biological plausibility of tissue injury and disease. So it is possible that electronic cigarettes could lead to cardiovascular disease because of the presence of this type of toxicants in the aerosol. Similarly, I'll just talk briefly about the respiratory diseases. This is showing a similar schematic where you have oxidant chemicals, again, could potentially lead to inflammation, bronchoconstriction, that could lead to asthma, airway remodeling. So there's also potential looking at formation of chronic obstructive pulmonary disease or COPD. EVALI, I'll just briefly talk about EVALI. This is something, we had this outbreak of severe lung injury. This is e-cigarette or vaping product use associated lung injury. In the US, 2,500 cases since as of December 27, 2019, 55 of these individuals, just 2.1% have died. We have respiratory symptoms such as cough, chest pain, shortness of breath, GI symptoms. Also may include fever, chill, weight loss, and possibly death. These injuries, one paper showed that based on lung biopsies from 17 patients, that these injuries resemble chemical burns. Now, the CDC analyzed bronchoalveolar lavage, or BAL, fluid from a large number of EVALI participants or patients, and then they found vitamin E acetate in the BAL fluid from 48 of the 51 EVALI patients. And none of these, the vitamin E acetate was not found in BAL fluids of healthy people. So EVALI is likely not related to nicotine e-cigarettes, like the e-cigarettes that I'm talking about. This is likely related to bootleg cannabis vape products. Regarding the conclusions by the NASEM on respiratory diseases, so we found no available evidence whether or not e-cigarette cause respiratory diseases in humans. Again, there's data always coming out, but I've not seen anything that have really changed the conclusions from this report. There's moderate evidence for increased cough, wheeze in adolescents who use e-cigarettes and an association with e-cigarette use and an increase in asthma exacerbation. And then just finally talk about cancer, because there is this potential presence of carcinogens in e-cigarette aerosol, like what we saw an increase in benzene exposure. There's also studies, vaping studies that show formation of formaldehyde, which we know is a carcinogen. So the risk of cancer is there. Currently, there is limited evidence from in vivo animal studies using intermediate biomarkers of cancer to support the hypothesis that long-term e-cigarette use could increase the risk of cancer, but there is no available evidence whether e-cigarette use is associated with intermediate cancer endpoints in humans. So this data is, we still have a lot more work to do to see whether e-cigarette use really leads to cancer, probably use of e-cigarettes for a much longer time. There's substantial evidence that components of e-cigarette aerosol can promote the formation of reactive oxygen species, lead to oxidative stress. We know this is an important mechanism, underlying mechanism of carcinogenesis. And I'll just give you my contact information in case you guys have any questions after this seminar or webinar.
Thank you so much for that presentation, Gideon.
Perfect. So hi, everyone. My goal today is to offer some perspective to clarify confusing and complex arguments made by proponents and critics of vaping. In the public health world, nicotine vaping products are often discussed in relation to harm reduction for adults who smoke and youth prevention. This has proven very challenging to balance clear messages about the harm reduction benefits of e-cigarettes without giving the impression to youth and non-smokers that the products are harmless. Health Canada has set a goal of reducing Canada's smoking rate to 5% by 2035. Although smoking rates have been steadily declining for decades, they seem to have appeared to have plateaued at around 15%. It often takes more than 30 quit attempts to stop smoking for good. Given the harm associated with cigarettes and the difficulties many people experience to quit successfully, harm reduction is definitely an area of interest. Even Health Canada has indicated that vaping is seen as a key component of the tobacco endgame and to achieving the 5% smoking rate by 2035. So currently, healthcare professionals recommend cessation counseling interventions and nicotine replacement therapy products that have been proven safe and effective, including the nicotine patch, gum, lozenge, spray, inhaler, and prescription medications to help people to quit. But what about vaping? Vaping can be seen as a client-centered option, particularly for clients who may have the goal of harm reduction rather than abstinence. Some argue that vaping as an alternative to smoking could contribute to declining smoking rates. According to the 2017 Canadian Tobacco, Alcohol and Drugs Survey, about a third of people over the age of 25 who vaped reported doing so to help them to quit smoking. So what's the difference between nicotine replacement therapy and e-cigarettes? Well, under federal regulation, nicotine replacement therapy falls under the Food and Drug Act. They are also a licensed product. To date, there is no vapor product that has been licensed by Health Canada to treat nicotine addiction, and it is known as a consumer product. Nicotine replacement therapy has clear and accurate nicotine labeling, whereas e-cigarettes may not disclose the nicotine levels or they may not be accurate. In terms of the nicotine dose, nicotine replacement therapy has standardized nicotine delivery, so it helps to taper towards cessation, whereas e-cigarettes, there's a lack of standardization, nicotine concentrations vary, and even the method of use varies. And the approach with nicotine replacement therapy is that it's often prescribed by a health professional. There's counseling involved, there's protocols, there's support. Whereas with e-cigarettes, it's a self-serve sort of trial and error, and you're often getting advice by retailers to use the product. With nicotine replacement therapy, it's limited access, so it's only available by your healthcare provider or in a pharmacy. Whereas with vaping products, they're available everywhere for purchase. So what's the difference? In terms of harm reduction, there is conclusive evidence that completely substituting e-cigarettes for combustible tobacco cigarettes reduces users' exposure to numerous toxicants and carcinogens. So from a harm reduction approach, it is widely agreed that e-cigarettes are much less harmful if people who smoke switch completely, but they are not harmless. There's also a lack of evidence that shows that using e-cigarettes as a smoking cessation aid is effective. Reviews such as those done by the Ontario Tobacco Research Unit find mixed evidence for cessation. Most people find that they continue to use e-cigarettes or continue to use both e-cigarettes and cigarettes. One reason for this may be that e-cigarettes can deliver high amounts of nicotine, which perpetuates the addiction. So when combined with behavioral counseling, e-cigarettes can outperform NRT, but e-cigarette use often persists. One of the ethical challenges for healthcare professionals who may see vaping as a harm reduction alternative for clients is the involvement of the tobacco companies purchasing vaping companies. Online ads like these undermine industry claims that vaping products are quitting aids. The message from these ads make business sense. The industry is not motivated to help people to quit, but instead to pull consumers to their alternative product, or in the case of tobacco companies, selling their own e-cigarettes to retain customers who may otherwise be lost to quitting. Although vaping is less harmful than smoking, it is not harmless. For people who smoke, switching completely to vaping can offer harm reduction, resulting in reduced risk of cancer, cardiovascular and lung disease, and overall improved quality of life. Switching also reduces the second-hand and third-hand exposure risks associated with smoking. Some short-term health effects include throat, mouth, and lung irritation. Long-term effects are largely unknown because this product is relatively new. But we do know that nicotine is highly addictive, and vaping nicotine could result in nicotine addiction. In youth and young adults under 25, nicotine can alter brain development and affect memory and concentration. In Canada, vaping has been linked to increase in smoking. Secondhand effects are less than smoking, but nicotine and other chemicals are admitted by vaping and may put bystanders at risk, particularly if they have compromised lung health. So what needs to change? Ottawa Public Health has responded to numerous Health Canada consultations with recommendations that vaping products be subject to regulations similar to tobacco, such as restrictions on flavors, plain and standardized packaging, and restrictions on advertising and promotion. Health Canada indicates that they will soon require nicotine content, ingredients, and health warning labeling on their products. Two more on vaping products. 2 more consultations are expected in 2020 concerning promotion and disclosure of ingredients. Health Canada is also working with partners to develop lower risk nicotine use guidelines. The industry also needs to be held accountable. They have engaged in subversive marketing tactics, false claims, and misleading information. So it's time to get it right. Adults who smoke have the right to harm reduction. But that does not mean that there should be any flavor available, that we should be targeting youth, that the industry should be under-regulated, and there needs to be upper limit nicotine concentration levels. Marketing tactics used to sell cigarettes are now being used to promote vapor products, including the use of celebrity endorsements, candy-flavored products, lifestyle marketing, sex appeal, and product placement in stores. Unethical targeting of youth is of particular concern for nicotine products, as most long-term consumers begin before the age of 19. Under pressure, some companies have changed their marketing to mitigate criticism that they are targeting youth. Many of the problematic messages are being perpetuated online by individuals and third-party contributors known as influencers. Since smoking rates have been declining, the industry depends on attracting new consumers with new products. As a result, youth vaping is growing in popularity. A study led by Professor David Hammond at the University of Waterloo found that those among 16 to 19 years old, vaping increased 74% from 2017 to 2018. Studies have also shown a positive relationship between vaping product use and the intention to smoke cigarettes among youth, including a recently published study that found that non-smoking youth who use vaping products were about 3 times more likely to be smoking conventional cigarettes than youth who did not use vaping products. Higher nicotine concentration products, such as the introduction of Juul in the North American market, are also linked to sharp increase in youth uptake and deliver a strong nicotine hit, increasing the risk of nicotine addiction. The 3 most common reasons that youth report trying vapor products include curiosity, flavoring taste, and low perceived harm. In 2018-2019, results from the Canadian Student Tobacco, Alcohol, and Drugs Survey validate what many healthcare professionals are seeing at the local level, that vaping has surpassed tobacco smoking. Vaping is attracting young persons and exposing them to nicotine and habitual inhalation of aerosol with unknown long-term health risks. In the past 30 days, there's been an increase in use in the past 30 days has increased to 20% in 2018-2019 from 10% in 2016-2017 among students in grades 7 to 12. 18% used an e-cigarette with nicotine in the past 30 days, and 17% of students stated that there was no or slight harm from regular use of e-cigarettes with nicotine, compared to 49% who stated that there was no or slight risk of regular use of e-cigarettes without nicotine. According to the 2017 Canadian Tobacco, Alcohol, and Drug Survey, 15% of individuals who vape but report never having smoked, 58% were youth, and 33% were young adults. Past 30-day vaping use among youth may be viewed as experimental, but research has found that a large majority are still vaping at 12-month follow-up and exhibit increased symptoms of dependence. So how do we strike a balance between harm reduction and youth prevention? Governments around the world are asking, will tighter regulation result in restricting the smoker's access and therefore greater health consequences? Or will looser regulations result in increased vaping and smoking among youth and new consumers? Different countries perceive the potential and risk associated with vaping very differently. The European Union has acknowledged the harm reduction potential of vaping, but with regulations. For example, the EU caps nicotine concentration at 20 milligrams per milliliter, but Canada has set a limit at 66 milligrams per milliliter, the amount determined to be highly toxic. New Zealand, in many ways, is actively promoting harm reduction potential, but has not imposed some regulations common to other countries. For example, residents can smoke in areas where smoking is prohibited. The US is prioritizing youth prevention and has declared a youth vaping epidemic. As a result, many states and municipalities are imposing their own restrictions, such as San Francisco with a complete ban on sales of vaping products and Michigan with a ban on flavors. In comparison, Canada is aiming for a balanced approach, but regulations have been slow to follow since the legalization of nicotine vaping products in 2018. So let's turn our attention to see what's in place in Canada to help strike the balance. In Canada, the Tobacco and Vaping Products Act regulates the making, sale, labeling, and promotion of vaping products, including products with nicotine. In 2019, the federal government introduced new regulations to prohibit the promotion of vaping products anywhere they can be seen or heard by children or youth, and requirements for labeling nicotine concentration, ingredients, and warnings, and child-resistant packaging. Actual enforcement dates for these new regulations are set to begin early to mid-2020. Some regulations, such as concentration of nicotine and flavors, are still expected to be further regulated by the federal government. In Ontario, we have the Smoke-Free Ontario Act, which prohibits the use of e-cigarettes in all the same areas where tobacco smoking is already banned. That means no smoking or vaping where smoking tobacco is prohibited. It's also against the law to give or sell vaping products to youth under the age of 19. Also, the promotion and display of vaping products in convenience stores is prohibited, and that's a new regulation that just began this year in January. The exemption is specialty vape shops where no one under the age of 19 is allowed entry, but they are allowed to display and promote vaping products in these shops. I'd like to switch gears and talk a little bit about vaping cannabis. So new this year, federally licensed producers are allowed to produce cannabis extracts for vaping products. Cannabis products intended for vaping are available from authorized Ontario retailers for adults aged 19 or older. So under the regulations, ingredients that can be used in cannabis extracts, including vaping products, are restricted. According to Health Canada, cannabis extracts are not permitted to contain anything other than carrier substances, flavoring agents, and substances that are necessary to maintain the quality and stability of the product. The use of sugars, sweeteners, or sweetening agents as ingredients in cannabis extracts, including vaping products, is not allowed. Nicotine, caffeine, and ethyl alcohol are prohibited in cannabis vaping products. Now, Gideon already touched on the emerging harms that are happening in the US. So in Canada, I would like to confirm that there have been only 17 cases of vaping-associated lung illness, and there have been no deaths. And as Gideon mentioned, that determining the cause of this has been troublesome, but it seems to be that it's acetate, vitamin E acetate that is the cause of it, and it's these unregulated products that are creating EVALI in the States. So as you begin your public health career, I just wanted to touch on that if you do come across a client that does smoke, these are some of the tips that you should be using with them. So every person that smokes, you should be asking them if they smoke, advise them that quitting smoking is the best thing they can do, and refer them to a healthcare professional or NRT. If they have, ask them if they have tried licensed nicotine replacement therapy, medications, or counseling. Ask about the difficulties that they've had trying to quit, and also to validate that it's hard to quit. And most people do make many, many attempts to quit for good. As I mentioned earlier, it takes on average 30 attempts to quit successfully. Now, if you come across a client that wants to vape, there are no nicotine vaping guidelines to help people to quit vaping. So this is just advice at this time. But again, vaping is only meant for adults over the age of 19 that smoke. So if they don't smoke, they should not vape. And as mentioned, you should not be using vaping products at all. They should know that vaping can be harmful, although it is less harmful than smoking. There are known and unknown risks associated with vaping. Ideally, they should switch completely so that they shouldn't be using, smoking and vaping. It should either be vaping. They should also be asking questions about what they're vaping. There are so many illegal black market vaping products out there, so they should be really an informed consumer. and they should limit the flavor variety as well. They should watch for signs of illness and seek medical attention. And ideally, they should make a plan to reduce and quit vaping. So they should be using the lowest nicotine concentrations, and they should be mindful of how often and where and why they vape. So for more information about vaping products, you can visit our website at Ottawa Public Health, or you can send us an email as well. Thank you.
Thank you so much. That was excellent and really complimentary to the presentation from Gideon. We do have a few minutes for Q&A, and we've received a few questions come in. So please post your questions now, and hopefully we'll be able to get through them all. So one question we have is about lung illness, and you both touched on this, but Claire is saying that in Canada, all cases have been associated with regular and legal products of e-cigarettes, so no cannabis or illegal products were involved. Can you say anything? About that?
Again, it's difficult to state if it is the vaping that's the cause of the lung illness. I read recently that it could be just a sensitivity to perhaps some of the chemicals that are in the vaping product that has affected the person. So at this point, just the evidence is not strong enough to say that it's nicotine, vaping products that are causing the lung illnesses. It could be a cause, it could be a situation where the person's already sensitive to other chemicals, or maybe has a sensitive lung health as it is.
So Gideon here, are we talking about the same type of lung injury that we see in the US?
So in Canada, it hasn't been shown that it's the vitamin E acetate that's causing these lung illnesses.
But is it the same lung illnesses that we're talking about?
Yes.
Okay.
Okay, thank you. And then we had a question on how to treat vaping addiction. Mark Andrew asked that earlier on, and I do think that Krista touched on that in terms of helping someone who wants to quit. So I don't know if there's anything more that you want to say about that, or perhaps we can hear from Gideon if you have any additional comments.
I'm not sure if there are tested medicines or medication for vaping cessation, but they could potentially use the same smoking cessation tools like NRT and other medication potentially to help with vaping cessation. Likely this person would need some sort of nicotine replacement.
Okay.
At this time in Canada, there are no clinical guidelines to treat vaping addiction. So the slide that I presented, that was mainly advice, but we're expecting Health Canada to develop these guidelines soon. Also, the Center of Addiction and Mental Health is also currently working on it. And I believe the Ontario Tobacco Research Unit is also compiling evidence to support the guidelines. So we're expecting those guidelines very soon.
Wonderful, thank you. There's a question for Gideon. Can you speak to evidence that has been released since the 2018 NASEM report? Has there been any emerging evidence around the risk for cardio and cerebrovascular disease or respiratory illness?
So I'm not aware of cerebrovascular disease, but there are studies, like I mentioned, that link use of e-cigarettes with heart attack. It's just that some of these studies have been controversial, and that's probably all I want to say about that. There's also maybe preclinical studies. There are studies that show oxidative stress, different biomarkers of maybe cardiovascular injury. There are studies that show markers of inflammation. So like just at this mechanistic level, but that's probably all I want to say here.
Okay, thank you. And I don't see any more questions, but I just want to raise something about engaging youth. So clearly, you both mentioned that youth are you know, being targeted and we're seeing a very big rise in prevalence among vaping among youth. So have you seen any strategies to engage youth around policy development and regulations? And do you have any suggestions about how we might want to attempt that to ensure they are effective?
Well, here in Ottawa, we right now we're just educating youth so that they're, again, informed about the health risks associated with vaping product use. Certainly, if there was a youth group that would be interested in furthering regulation, we're all open for it. But at this time, I think that there are so many myths and that kids don't fully understand the health risks involved. So right now we are out in our high schools. We do in-class presentations. Also, we have a partnership with Health Canada that goes in and does this really great display with youth and walks them through these different stations. So they really have hands-on learning about the dangers of vaping. So that's where it's at right now.
So Krista, you mentioned something earlier about having an upper limit for like nicotine concentration of e-liquids.
Yes.
I think there's a question about whether this would be effective because yes, a lot, for example, like Juul, some of these like nicotine salt-based devices, they use really high nicotine concentration. And a lot of people are really freaked out because of this really high nicotine concentration in the e-liquids. But the amount of nicotine that's delivered to a user, really, you have to consider both the power of the device, the electrical power, and also the nicotine concentration of the e-liquid. So a device like Juul is a really low-powered device. So you need a really high nicotine concentration to even deliver sufficient nicotine. Whereas some of the powerful mod devices that use like 100 watts, 50 watts, some people go as high as 150 watts. They use really low-level nicotines, for example, like 3 milligrams per milliliter, which is much, much lower than Juul. But these deliver high amounts of aerosol. So if you just target like having a higher limit for like nicotine concentration, people who use these mod devices, they're not affected at all by this type of regulations. So I think really consider that.
Yes, definitely. The various devices that are out there make it complicated as well. But right now, as I mentioned, with Health Canada has set a limit of 66 milligrams per milliliter, which is extremely high and could be toxic, especially if a child was to ingest it, for example. So I guess the EU has reduced it to 20 milligrams per milliliter. I'm not sure if that's the way Health Canada is going to go, but it's something to consider for sure.
Okay.
Well, thank you. As it happens, I just got about 6 questions come in all at the same time here, and looking at the clock, I don't think we'll be able to get through them all. We can try. I think some of them we've touched on in terms of youth, getting information out there to youth, guidelines. I don't know, Krista, if you know quickly when those are expected.
We've been waiting. We've been waiting with bated breath for them. So we're
okay.
Right now, I think that slide I showed you with the advice. I mean, that is so key. Is that if you're an adult smoker, then you can vape as a harm reduction, but you should not be vaping if you don't smoke. And of course, youth shouldn't be using it at all. And, to help them, to lower those nicotine concentrations and just to make a plan to quit. Don't think that this is your solution for the rest of your life. But, if you are going to use it as a quit smoking aid, which we know it's not, but if you are, you should be trying to taper down your nicotine concentration levels and make a plan to quit, ideally.